Today we are joined by Dr. Dawn Marcus of the University of Pittsburgh. Dr. Marcus has authored over 100 articles on the topic of chronic pain and headache, as well as numerous books on chronic pain and migraine. Dr. Marcus, thank you for joining us.
Well, thank you very much. And as you had mentioned, tonight we're going to be talking about two of my favorite topics, fibromyalgia and headache, and they're much better topics to talk about than problems to have, but they're very common problems, and that's why we're having the discussion this evening. I first wanted to start out by introducing myself a little bit. I'm a neurologist and a pain management specialist, and have really focused on fibromyalgia, migraine, women's issues, and complementary therapies for probably about the last 20 years. During that time, I've written over 100 research articles on fibromyalgia, migraine, and chronic pain, and have also authored a number of books, including several books on fibromyalgia and also several books on migraine. And I maintain a pain and women's health blog called www.dawnmarcusmd.com, and I often have information there about fibromyalgia and migraine and some of the research that we're working on. So first, let's talk a bit about fibromyalgia, and what is fibromyalgia? And fibromyalgia is really a chronic pain condition, and the main hallmark of fibromyalgia is that it's a condition where people have pain that's considered to be widespread. It affects a lot of different areas of their body. It's not just back pain. It's not just head pain. It can be pain that really can affect any area of the body, and most of the time, many different areas of the body are affected, although on any given day, you may have different areas involved. So it's not always certain areas or other areas, but the pain can sort of come and go across different areas, which can also be very frustrating. Now, even though it's called a chronic pain condition, there are a lot of other important and disabling symptoms that go along with fibromyalgia, and probably the most common ones are having problems with fatigue, sleep disturbance, problems with depression and anxiety, and there are also very common problems with concentration and memory, or what people sometimes call fibrofog. Digestive problems are also very common, and there can be a whole host of other symptoms that folks can have as well. That could be urinary symptoms, menstrual symptoms, weird sensations or numbness in different places of the body. Really, a whole host of symptoms in addition to the pain that goes into that whole fibromyalgia syndrome. Now, there are a lot of myths about fibromyalgia, and I think it's really important to talk about these because you'll often hear from people different things about what they think fibromyalgia is or isn't, and it's important to really have the facts straight so you know really what to expect with fibromyalgia. One of the things that people often think is that fibromyalgia is a very rare condition. You don't hear a lot of people talking about fibromyalgia. You don't see a lot of TV commercials about different remedies for fibromyalgia. So sometimes there's a thinking that, it's really not very common. And actually, fibromyalgia affects about 2 to 3 of every 100 adults in both North and South America and in Europe. So it really is a very common problem that you really do see across the globe. One of the other myths with fibromyalgia is that fibromyalgia is just a woman's disease. And this can be very frustrating if you happen to be a man who has fibromyalgia. And it can be very difficult for men who have fibromyalgia symptoms to get diagnosed because often even healthcare providers have this perception that fibromyalgia is a woman's disease. Women are actually affected about 3 times more often than men, but men can also have fibromyalgia as well. The other big common misperception with fibromyalgia is that it's really a young person's disease. And if you do see information about fibromyalgia, you'll often see images of young women in their 20s or maybe early 30s, complaining about their pain syndrome. And this can really give an impression that fibromyalgia affects young women in the same way that migraine is sort of a younger person's disease often. And with fibromyalgia, it's actually interesting that the average age when women start having fibromyalgia is actually about 45 years old, and the same really holds about true for men as well, although it's been studied a little bit better in women. So for women, you're much more likely to have fibromyalgia when you're in middle age or when you're becoming a senior. So it's not necessarily something that you would have had when you were, a young mother or a younger adult. It may very well be something that you first start getting once you're thinking about retiring or, getting into those middle-aged years. The other thing to remember with fibromyalgia is that even though it's a chronic pain condition, people sometimes have the impression that, well, it's just a little bit of pain, so what's the big deal? And it's important to recognize that fibromyalgia, whether it's the pain or the other symptoms that go along with it, can really be quite disabling. So it really is a very important condition to identify and an important condition to get treated because it really can affect a lot of different areas of your life. When people have fibromyalgia, it often takes them a very long time to get a diagnosis, and in most cases it actually takes several years. And this can be particularly frustrating when you're that person who's having symptoms and you're just wondering, what's going on? I'm feeling fatigued, I'm having all this pain, I'm feeling very irritable and anxious, and is there anything wrong with me? Am I just too nervous about things? What's going on? And those years that can go by between starting to have symptoms and finally getting your diagnosis can really be very frustrating and discouraging for people. On this slide, we have some information from a survey that was conducted of 800 people worldwide with fibromyalgia. And they found that, again, across the globe, it didn't really matter which side of the globe you were on. It really took several years before most people got their diagnosis. And there are several reasons for this. There's delays with the patient, and there's also delays with the doctor. For most people with fibromyalgia, they actually didn't start talking to the doctor about their symptoms until they'd been having them for almost a year. And 2 in every 5 people delayed talking to their doctor because they didn't think their complaints would be taken seriously. And it's important to remember that when you start having complaints that sound like fibromyalgia, to really get a jump on that, start getting that looked into right away rather than waiting and hoping things will get better or wondering if this is really a serious enough complaint to bring up to your doctor. The other problem was after telling the doctor, it took an average of an additional 2.5 years before people finally had their diagnosis. And the average person actually saw 3 to 4 doctors before getting diagnosed. So it's often a very long road to get that diagnosis, and that can be very frustrating. It can be helpful, though, sometimes to realize it's not just your doctor who's slow at making the diagnosis. Unfortunately, the slowness in getting that diagnosis made really is something that's very widespread. Now, in an effort to try to improve diagnosis, the American College of Rheumatology has come up with some new strategies for diagnosing fibromyalgia. The first criteria were put together in 1990, and those criteria required a physical examination by your doctor to test for different tender points on the body. And it's been found since those criteria first came out that many doctors find performing that examination to be a little bit difficult and confusing. And the other problem is you have to have a certain number of those points as being tender in order to meet the diagnosis of fibromyalgia. Now, because we know fibromyalgia is a condition that fluctuates day after day, and some days you'll be having more severe days than other days, if you happen to see your doctor on a particularly good day, you may have fewer of those tender points than on a bad day. So if they try to do your diagnosis on a good day, you may not get the diagnosis because you didn't get enough of those points. So in order to address that problem, new criteria were established in 2010, and then a year later they were updated. And a lot of centers, including our center, are underway trying to come up with simple strategies to use those criteria to make it easier for people to get a diagnosis. And we actually recently published a very simple questionnaire using those criteria that can be effectively used to diagnose fibromyalgia. And this is a questionnaire that people who have symptoms are able to fill out themselves. And this slide shows those questions. And there's only 6 questions to answer. It looks a little confusing on the slide because it's divided in those 2 columns, but it's really only 6 questions. The first question asks where in your body you've had pain or tenderness over the last week, and you just check off each of those areas that's been painful. The second question asks you to rate how severe your fatigue has been over the last week. The third asks you to rate the severity of waking up and not feeling refreshed. The fourth is rating the severity of problems with concentration, memory, or thinking. And then the fifth asks you over the last 6 months if you've had problems with headache, abdominal pain, or cramps, or depression, and you just check off those symptoms that you have had. And then the last question asks if you've had pain for at least 3 months. And the reason for 3 months is because that's what doctors use to decide if something is a chronic condition versus it's a newer pain problem. Because if it's a newer pain problem that you've just been having for a few weeks or a couple of months, you probably need a different type of an evaluation than if it's something that's been going on for many months or many years, as is often the case with fibromyalgia. So once you've completed those questions, then you need to score them. And for the first question, you just count the number of areas where you had the pain, and there's a possibility of saying none of the areas, which would be a 0, or all of the areas, which would be 19. Then for questions 2 through 4, asking about fatigue, waking, feeling unrefreshed, and concentration problems, you look and see which you checked off. If it was none, that scores a 0, mild or intermittent was 1, moderate or often is 2, and severe or disabling is 3. So for each of those questions, you can score from 0 to 3. So you add those scores together for a total of those scores of 0 to 9. And then for the fifth question about having abdominal pain, headache, or depression, you see how many of those you checked, and you may have checked none, you may have checked all 3, so you could score anywhere between 0 to 3. Then you add the numbers for all of those questions together, which gives you a possible score of 0 to 31, and that's called the FS score, or Fibromyalgia Severity Score. And then what you do is you look to see if you answered yes to question 6, is this a chronic pain problem? It's lasted for 3 months or longer. And if the FS score is 13 or higher, then it's very likely that you have fibromyalgia. So this is something that you can look at, you can score, take to your doctor and say, hey, I looked at this, I think I may have fibromyalgia, and then they can really make sure that there's not some other health condition that's causing those problems, and if not, really get you on your way to getting that diagnosis nailed down. So tonight we're talking about fibromyalgia and headache as well, and you might wonder why we're talking about both of those things. And it's interesting that people who have fibromyalgia, in addition to having widespread body pain, often also complain about having chronic headache problems. And people who have chronic headaches, like migraines, often complain about having fibromyalgia. And indeed, if you have fibromyalgia, you're much more likely to also have a chronic headache condition than people who don't have fibromyalgia. And by the same token, if you happen to be someone with migraine, you're at higher risk for developing fibromyalgia than people who don't have migraine. So those two conditions tend to occur more often together. On this slide, we see the results of 2 separate studies. On the left are the results of 100 patients that we saw at our center who had fibromyalgia, and they were coming into our center for fibromyalgia treatment. And this population was particularly interesting because even though we had asked about all of their different pain complaints, they really said, you know, they really just had fibromyalgia. That was their only pain complaint. They weren't complaining about headaches. And even though we advertised that we have a headache treatment center, none of them had mentioned to their treating doctors that headache was a problem. So we were actually quite surprised when we asked them if they had troublesome headache, that 3/4 of them actually did have problematic headache, even though, again, it was something that they had not brought up with their doctor. And only 1/4 of them said, no, I don't have a headache problem. The other thing that was a big surprise for us was about half of these patients actually had migraine headache, which was not what we were expecting to see. We were expecting that they might have tension-type headache or headache related to the overuse of medications, since a lot of fibromyalgia treatment patients may be treated with medication. We thought maybe that would be an issue, but actually most of them had migraine headache, so it really helped to establish that link between fibromyalgia and migraine. On the right side of the slide are the results from a recent review of 8 different studies, and in all of those studies, they evaluated people who had migraine as their diagnosis and tried to identify if those people who primarily had a migraine diagnosis also had fibromyalgia. And what these studies showed was pretty consistently that about 1 in every 3 adults with migraine will also have fibromyalgia. So if you have fibromyalgia, there's a much higher chance you'll have migraine, and for the migraine sufferers, there's a much higher chance that you'll have fibromyalgia. So if you've been diagnosed with either of those conditions, it's important to also think about the other one as well, because you are at risk for having that or developing it. Now, we recently did an online survey looking at a variety of changes that happen in people who have migraine. With the survey, a little over 1,400 adults with migraine participated. Some of those might have been you folks, and if you were participants, thank you very much. We always appreciate people who participate in our surveys. And we asked people with migraines a whole bunch of questions. And one of the things that we had people complete was that questionnaire that I showed earlier, asking about possible fibromyalgia symptoms. We scored those surveys, and what we found was with this sample, about 1 in 4 of those people who were migraine sufferers also had fibromyalgia, so pretty consistent with those earlier studies, again showing that tight link between migraine and fibromyalgia. We then decided to look at those people with migraine who had fibromyalgia and see how they might be different from migraine sufferers who don't have fibromyalgia. And what we found was that having fibromyalgia tended to be linked with having more frequent migraines and actually nearly double the chance of having chronic migraine or having headaches 15 days a month or more, and also a higher risk of having more significant depression or anxiety. So again, if you're a migraine sufferer and you have fibromyalgia, not only might you have additional pain complaints, but it's likely that the fibromyalgia is actually aggravating your migraines, and it may very well be aggravating your mood. So again, all the more reason to really look at all of the areas that you're having pain and symptom to really help identify, might fibromyalgia also be a problem for you. So what do you do if you have fibromyalgia? And there's really good news and bad news with fibromyalgia. Much in the same way as migraine, there's no cure for fibromyalgia, but there are effective treatments. Probably the biggest difference between fibromyalgia and migraine is that there are a lot of medications that can be very helpful for migraine, and really there are fewer medications that help with fibromyalgia, and the extent that they help tends to be much less. With fibromyalgia, the real core of treatment has to be a strong foundation of exercise. And ideally, one should try to alternate aerobic and strength training exercise about 5 days each week. So what you would want to do would be to do aerobic exercise every other day for 3 days, and then in between those days, do a couple of days of strength training, and then you'd have a couple of days of rest in between. And for aerobic exercise, things like walking, bicycling, and swimming are excellent aerobic exercises. Now, if you have fibromyalgia, you may be thinking, I already hurt so much all over. I am so tired. I can't imagine trying to do exercise because I just don't have any extra energy, to go about my day, let alone, go to an aerobics class or start bicycling or swimming or jogging or doing, an aerobics program. And it's important to know that when you have fibromyalgia, the reason that you're so very fatigued, or at least one of the reasons, is that the muscles of people who have fibromyalgia are different from muscles of people who don't have fibromyalgia. So when you feel like you fatigue more easily, that's actually what is happening. The muscles do tend to fatigue with fibromyalgia much more easily than they do for people who don't have fibromyalgia. So that's even more of a reason when you have fibromyalgia not to avoid exercise, but to really start at a low pace and then increase very slowly. So starting low and going slow is particularly important for fibromyalgia. So consequently, you wouldn't want to necessarily start an exercise program with a friend who didn't have fibromyalgia, who said, oh, let's go out jogging today and see how it goes, because chances are it would be such a strain on your musculature and your body that you may have severe flares and pain and severe flares and fatigue that would discourage you from doing exercise in the future. So, again, you really need to find a comfort level, start at that, and move along slowly. Yoga can also be a wonderful exercise that has been shown to be very helpful for fibromyalgia symptoms. Both aerobic exercise and strengthening training, as well as yoga, have been shown to improve physical tolerance, decrease pain, improve mood, decrease fatigue, and also improve sleep. So a lot of those real common symptoms with fibromyalgia do get better with aerobic exercise and yoga. And some studies are actually beginning to show that fibro fog seems to improve with this exercise as well. So, really it can be, a strong cornerstone to treat a whole host of important fibromyalgia symptoms. But it's important to remember that you need to start at a comfortable level for you and then move slowly from that. So what you would want to do would be to find out, what your current exercise level is, a level where you can comfortably do that exercise and not have an increase in your symptoms, and exercise at that level for about a week. Then at the end of that week, if you're feeling comfortable, then to make a small increase. And that small increase should be no more than about 25% of what you've been doing. So if you were walking for 20 minutes, maybe try and add an extra 5 minutes to that. Keep up that exercise duration for the next week, see how it goes. If you're tolerating that, then again to make another small increase. If you increase the intensity of exercise, you'd want to decrease the duration, and then once you were comfortable with the intensity, then start increasing the duration again. So again, just making those small steps forward rather than trying to jump into exercise and do too much too soon. Stress management and relaxation can also be helpful treatment. Sleep hygiene can be helpful, and there are some medications. The most effective medications would be antidepressants like duloxetine or Cymbalta, or milnacipran or Savella, and the anti-epileptic drug or neuromodulating drug pregabalin or Lyrica. The thing to remember about all of those medications is, although they can be somewhat helpful, at best they result in a modest improvement in symptoms. So they can be used in conjunction with your exercise and your other treatment, but they're probably not going to be overwhelmingly helpful if that's really what you're relying on as your solo therapy. There also are some nutritional therapies and supplements that can be helpful, and I find that it's real easy to find out information about what medications to use. It's often more difficult to find out about nutritional therapy. So the last slide just has some information on those nutritional supplements that have been shown to be helpful for fibromyalgia. Now, of these, the two that have been studied the best and have been shown to be the most helpful would be accidental methionine or SAMe and melatonin, which is a sleep aid that you would take at bedtime. And those have been shown to be helpful for a wide range of fibromyalgia symptoms. And there is the best data really supporting that those are helpful. Some other vitamins have also shown to be helpful. With vitamin D, which people are often real interested in, this has only been shown to be helpful if your doctor finds that your vitamin D level is low. So if your level is low, then it should be replaced to get to a normal level. If your vitamin D level is not low, taking extra vitamin D will not help. At the bottom, I list magnesium, zinc, and probiotics, which theoretically should be helpful for some fibromyalgia symptoms or may be helpful for fibromyalgia from a theoretical point of view, but there really haven't been studies done to look to see whether they're helpful or not. So, it's really hard to know whether they're helpful and hard to recommend doses. But the good news is, again, there are a lot of treatments that one can use, but they really should be administered with that core foundation of exercise. So that was all I wanted to mention to the group, and I wanted to open up for questions.
Thank you, Dr. Marcus, for joining us and giving us that great presentation. Our first question is fibromyalgia hereditary? From Emily.
Yeah, actually it's interesting. Years ago, people did not think that fibromyalgia was hereditary, and now it's actually become quite clear that fibromyalgia is a hereditary condition. If you have fibromyalgia, it's likely that other people in your family do as well. About 1 in 3 children of a woman with fibromyalgia will develop fibromyalgia. So it's not, all of the children or most of the children, but more than you would expect by chance alone. And they're actually now looking at different genetic markers, trying to see if there may be some genes that are linked to fibromyalgia. And that research is kind of early, but it does appear that there may be some genetic links that will be identified, hopefully in the next 5 or 10 years.
Our next question is from Sherry. I've had daily migraines for 7 years, and I've been diagnosed with fibromyalgia. I have a history of 3 different head traumas, and I'm wondering if trauma could have contributed to fibromyalgia and migraine.
Yeah, absolutely, and trauma really can, can be a factor for both headaches and for fibromyalgia as well. There have actually been some studies done looking at the role of trauma in fibromyalgia, and people who have fibromyalgia that begins after trauma actually appear to respond a little bit differently than those who have have fibromyalgia that occurs, sort of out of the blue, or for unknown reasons. So, trauma may very well be a factor for both the headaches and for fibromyalgia.
Thank you. Our next question is from Alicia. I've had migraines since middle school, and I'm now 35 years old. I was diagnosed with fibromyalgia about 10 years ago. I've been on many different medications for both. The only thing that has helped is Topamax, muscle relaxers, and Imitrex. Right now I'm taking Imitrex and muscle relaxers only. Will either ever get better?
The good news about pain conditions is generally they get better over time. Unfortunately, it can take a long time for them to get better on their own. I think most of the time, the key thing to do is to really look at, what else you might do that can make an important impact in your pain symptoms. And often there are some lifestyle changes that one can make, either making changes in diet, changes in sleep patterns, changes in exercise routines, or adding new exercises in, or even trying something like yoga if you haven't tried that before, or Tai Chi, which can be very helpful for decreasing both migraines and fibromyalgia, and hopefully helping those medications to work better. The other great news with both fibromyalgia and migraine, and this is really a time when people are doing a lot of investigations into identifying the causes of those conditions, which means new treatments are being developed all the time and are being looked at. So even if you're not finding a treatment that's particularly helpful now, new things will be coming up. So it's important to keep in touch with your treating doctor and to find out what's new on the horizon, what else can I try, but also to remember that if you can combine medication and non-medication therapies, you really have the best chance of good success.
Our next question comes from Sherry. Is it normal to feel as if there are bugs crawling on my skin, or to be itchy and have tingling and numb sensation on my skin with fibromyalgia?
Yeah, fibromyalgia can cause a lot of very weird sensations, and can have areas of numbness or areas of change sensation like you're describing. It's important if you're having those kinds of symptoms, to let your doctor know, just on the chance that maybe it's not fibromyalgia, maybe there's some nerve irritation, maybe you're having a reaction to some medication that you're taking, or even an allergic reaction to a new soap you're using or something like that that's causing an irritation on the skin. But after they've looked at things and they really can't find a particular cause, fibromyalgia very often causes these unusual, often difficult to describe sensations that can really be very very disturbing and very unpleasant. And sometimes those kinds of sensations are things that the medications like the antidepressants or Lyrica can be helpful for decreasing, since they can really target some of those abnormal nerve sensations.
Thank you. Our next question comes from Lanita. The only true relief I get to break the migraine cycle comes after it goes on so long and they give me a steroid shot. I know you can't stay on steroids long term, but is this relief common? Is there any information on how steroids affect fibromyalgia, or is there any dosage that might be beneficial in controlling inflammation?
Yeah, steroids usually are not used for treating fibromyalgia. They can be used for treating bad migraine episodes, and when people find that they do have a series of migraines, it just seems to go on and on and on, and nothing will break it. Having that dose of steroids or that shot of steroids can be a way to break up that migraine cycle and stop that particular episode. That's probably something that would be more used for migraines per se rather than fibromyalgia. And if you're finding that that's the case, one of the things to talk about with your doctor is what other things can you be doing once that cycle is broken. What can you be doing to help keep those headaches under better check and keep the fibro symptoms under better check. And again, I really can't reiterate enough, the importance of a lot of the non-drug therapies that people can use, things like relaxation, biofeedback, stress management skills, different exercises, using things like yoga or Tai Chi. And I think a lot of times we think, well, that's not really, a real treatment. That really can't do anything that profound to be changing my body. But it's amazing that when one is engaged in those kinds of therapy, it really can help change the amount of chemicals that are released from the different nerves in your brain and nervous system. It can really sort of reset the balance of a lot of that pain chemistry that's causing those symptoms. So really, those kinds of therapies are just so important to be incorporating, into your everyday treatment regimen.
Thank you. Our next question comes from Cheryl. Is there a connection with thyroid, specifically hypothyroid? Also, have you noticed if the compounded thyroid replacement works better than the cheaper synthetic medication?
Yeah, I don't know that anybody really knows that a particular thyroid medication works better than another, and it's actually a little bit of a controversy in the fibromyalgia community about the role of hypothyroidism and fibromyalgia. Most of the time, if you have fibromyalgia or your doctor thinks you may have fibromyalgia, you will be tested to make sure that your thyroid is working properly. If your thyroid hormone level is low, then your doctor is going to treat that. And in some cases, if you're very lucky, that may really be the cause of all of those symptoms that seem to be fibromyalgia, and that's all you need to do. Oftentimes, that's just really sort of an additive problem, and you still have fibromyalgia symptoms, but treating that low thyroid can really be very helpful, in decreasing a host of the symptoms that you may be having. It's a little bit more controversial when people either have a normal thyroid level or a low normal level, whether taking additional thyroid hormone is beneficial or not. And again, it's a little bit controversial. Some doctors really swear that that thyroid medication is very helpful, even if you're in that normal range, but you're sort of at the lower end. And other people really feel that it's not. And the literature is sort of on the fence there, so it's hard to know. But it's something that's important to bring up with your doctor. Make sure you have had your thyroid checked. See if it needs to be supplemented, and if it is, try whatever thyroid medication they're recommending. Now, it may be that you particularly will respond better to one thyroid therapy than another. So if you're finding that one tends to do better for you than another, again, that's something to be sure to let your doctor know, that you're responding better to one therapy than another, because even though most people may respond equally well to a lot of different therapies, as an individual, you may have a particular physiology that you're doing better with, a particular variation of a therapy than somebody else may.
Thank you. Our next question comes from Jenny. What causes the onset of fibromyalgia symptoms? You mentioned that the muscles of those with fibromyalgia have different muscles. Is fibromyalgia developed, or is one born with these different muscles and the symptoms may or may not appear?
Yeah, at this point, I don't think we really know. The genetic testing that's being done and the fact that fibromyalgia does seem to have an inherited component really suggests that people are likely born with a susceptibility, at least, to fibromyalgia. And then what then brings out the symptoms later in life, is hard to know. In general, there are a lot of different changes in the body that tend to happen with fibromyalgia. There are hormonal changes in addition to thyroid changes. Other hormones are affected as well, like growth hormone, which doesn't affect your growing, but can affect a variety of symptoms as you're older. There are inflammatory changes that seem to be more pronounced in people with fibromyalgia. There are changes in the nerves in people with fibromyalgia. If you look at brain imaging that looks how the brain is functioning, the fibromyalgia brain tends to be much more sensitive than the brains of people who don't have fibromyalgia. And experimental studies show that fibromyalgia people are more sensitive to stimulation. They're more sensitive to pain than people who don't have fibromyalgia. So the nerves seem to be revved up more, or what's called sensitized, to stimulation around you, and that may be part of the reason that you feel pain more. Sensations may be more unpleasant to you than they are to people without fibromyalgia. So really, researchers are finding a whole host of different physiological changes happening with fibromyalgia. Now the question is, are those changes causing fibromyalgia, or are they a consequence of having fibromyalgia and the fibromyalgia was actually caused by something else? And at this point, we really don't know the answer to that. Until 1990, when the American College of Rheumatology put together their diagnostic criteria for fibromyalgia, there was really no way to identify people who had that condition. There wasn't a lot of particularly helpful research that was being done. And then after 1990, when you could really pick out people and say, these people have a specific condition that seems to be similar to each other, and now we can study them, then people began noticing all of the different biological changes. So that research has really blossomed in the last 10, 15, or 20 years or so, but it really, in a sense, is sort of in its infancy as well. I think the good news as a patient is that if you have fibromyalgia, these studies really help to show that it's not something that's all in your head, or it's an imaginary thing, or you just like complaining and that's why you're saying you have symptoms. These studies really help to show that without a doubt, fibromyalgia is a very real biological, physical condition that is affecting a lot of different areas of the body. It's not only that you say you're more sensitive to pain, your body truly is more sensitive to pain. And it's not that you say you fatigue more easily, your body truly does fatigue more easily. So really the studies are very helpful in that way. Unfortunately, we really don't know what the cause is, and consequently, because no one has yet figured out the cause, one doesn't have a cure. But as more research is done and people are learning more about the genetics, presumably at some point they will identify, aha, this is what is causing all of these changes. And now the question is, do we treat the cause, or can we treat some of those physical changes that we're seeing along the way? And that really will be the future treatment of fibromyalgia.
Thank you. Our next question comes from Cheryl. What is the physiology of fibro and muscle fatigue? Is it endocrine related?
Yeah, and again, there are just so many different changes that happen with fibromyalgia. It's very hard to say this is the one thing. And I think fibromyalgia is interesting in that way because not only are the symptoms highly variable and affect so many different aspects of your body and of your life, but the physiological changes that we're seeing are also highly variable, affecting so many different organs in the body. So there are changes that you see in the nervous system, there are changes that you see in the muscles, there are changes that you see in hormone levels, and then there are genetic changes as well. So it's really hard to say, like, what is the most important change? What's the first change? Is it a cascade that one thing changes and then it's like a domino effect, and that the nerves change and that causes the muscles change and that causes the hormones to change? And at this point, we really don't know. But the symptoms like pain and fatigue are probably a combination of all of those things. The nerves being extra sensitive, just sort of being on alert all the time and responding excessively to all the different sensations that are hitting the body, rather than being able to dampen themselves and ignore things as normal physiology would do. And then also the muscles just not having the right configuration and the right amount of energy producing structures and all of those things that make you more prone to fatigue, and then also having the hormonal changes that again affect all those symptoms as well. So it's really very much a combination of all of those different changes that are probably working together. The problem with that, of course, is that you can't just treat one simple thing. You probably need a variety of treatments that are addressing a lot of those different areas, which is why you'll see people with fibromyalgia doing things like, I have a sleep program and I'm doing my exercise and I'm taking a low dose of an antidepressant and I'm also taking my thyroid medication. So the doctor's really trying to hit a whole bunch of those different physiological areas all at once, because fibromyalgia is affecting a whole bunch of different physiological areas at once.
Our next question comes from Astardi. Is there any common age range for
I missed the end of the question, but I think the question was the age range for fibromyalgia. And the most common age for fibromyalgia to start is 45 years old. As you become older, the number of people who have fibromyalgia actually becomes higher, and part of that is because once you get fibromyalgia, they tend to be symptoms that you'll tend to keep for 10, 20, or 30 years. So as people age, they still have the symptoms, and more people are added into that pool of folks who have fibromyalgia. So if you had a fibromyalgia clinic, for example, or a fibromyalgia support group, and everybody with fibromyalgia came to it, you probably would have predominantly women who would be late 60s, 70s, 80 years old. Not that everybody who has fibromyalgia is within that range, but if the symptoms are starting when you're 40 or 50 years old and then you keep having them, eventually you do get older and those people cluster together. So it really does tend to be a condition that actually affects people in middle age or as seniors much more so than younger folks, although younger folks can get fibromyalgia as well.
Thank you. Our next question is from Thomas, who is a male with fibro, osteoporosis, and daily chronic migraine. Are there any studies indicating fibro can cause severe bone loss?
I have not seen that. Potentially some of the medications that one's using or lack of exercise could be an issue as far as bone loss. But fibromyalgia per se, I have not seen it, or migraine as being particularly linked with osteoporosis.
Our next question comes from Nancy. Has there been any research to advance non-narcotic pain relief?
I think most of the research for fibromyalgia has been to try to advance non-narcotic pain relief, mainly because narcotics, for whatever reason, are not particularly helpful for fibromyalgia pain. And I think narcotics are actually very interesting medications because we talk about them as being pain medications, and truly, they are pain pills, but they're very helpful for certain types of pain and don't help so much with other types of pain. And migraine and fibromyalgia are two very unpleasant, painful conditions that, it's real pain, but for whatever reason, narcotic medications just tend not to be very effective in decreasing either migraine pain or decreasing fibromyalgia pain. So most doctors actually really try to minimize the amount of narcotic medication that's being used to treat people with migraine or fibromyalgia, because there is that concern that it's really not going to be very helpful, and you just can end up having side effects with it without a lot of benefit. So really the research has looked almost exclusively at non-narcotic therapies because narcotics tend not to be real helpful. The other interesting thing about narcotics that we're just really beginning to learn about is if you're taking particularly high doses of narcotics for long periods of time, that actually causes changes in the body and in the nervous system that makes you more susceptible to pain and makes you more sensitive to pain, and actually will make your pain become worse. So people are just beginning to recognize that high doses of narcotics, particularly taken for long periods of time, can wind up with a host of problems, but one of the problems is that it also tends to make pain more severe, and this is part of the reason that doctors are really trying to cut back on the use of narcotics, even for those pain conditions where narcotics tend to be helpful, because of the problems that can ensue with narcotics, including that increase of pain complaints just because of sort of resetting that balance in the nervous system when you are using high doses of narcotics for long periods of time.
Our next question is from Sharina. I have a disc bulge in my neck, and after I found that out, I was later diagnosed with fibromyalgia. I currently take Lyrica, and it seems to help, but the headaches are sometimes unbearable. What can I do?
Yeah, the one question to ask your doctor is the disc bulge something important or not? And on one hand, that sounds like a silly question because you would think, of course, a disc bulging in my neck would be a serious problem. But it's interesting, after we all turn about 25 years old, the areas of the spine that tend to move, which are the lower back or lumbar spine and the upper part of the spine or the cervical spine or neck, because we move them all the time very frequently, those are areas that as we get older, they tend to develop degenerative changes, including things like bulging discs. So it's actually very unusual when people become adults, but particularly middle-aged or older adults, not to have bulging discs or herniated discs in their neck and lower back, because it's just a very sort of common part of the normal degenerative process that we go through as humans as we become adults and age. And in most cases, those bulging discs and even herniated discs aren't causing any problems. If you look at them on scans, though, they can really look very frightening. You think, oh my gosh, look at that big disc is sitting out there. What's it doing? That must be something really bad. But doctors should be able to identify the level that the disc is at with particular symptoms that you're having. And you should be able to link a disc at this particular site should be causing this specific set of symptoms, like numbness or weakness or changes in reflexes, etc. So that your doctor should be able to say that disc bulge is causing you problems, or that disc bulge is not a problem. And again, it's very, very common to have disc bulges that don't cause problems. So the bulging disc in and of itself is not necessarily something to worry about. Having headaches, however, is something to be concerned about, which may or may not have anything to do with the disc. And if you're finding that you're getting treatments and your fibromyalgia symptoms are getting better, but you're still having problems with headaches, then that's a good time to stick with that fibro treatment and then really begin to focus on the headaches. And sometimes it's just a matter of adding some traditional migraine medications to that if you're having sort of infrequent migraine headaches. Or it may be that in addition to the fibromyalgia, you're also having changes with the joints, changes with the muscles in the neck, and sometimes even things like some physical therapy or some exercises can be real helpful in improving posture and decreasing the stress and strains that are going on there that can aggravate headaches. And sometimes even simple things like nerve blocks in the back of the head or neck can really be very helpful in breaking up a headache cycle and getting things knocked down a notch, so that that exercises or other kind of treatments can really be very helpful. So the bulging disc may be a problem that may very well be a red herring. So it's really important when you've been told you're having bulging discs to talk to your doctor and to say, is that causing me to have symptoms? If so, what might those symptoms be? Usually bulging discs are not going to cause problems with headache, but again, it's something to be sure to talk with the doctor, see if that's the problem. If that's not the problem, then to sort of look at what else may be causing the headaches, which could be something like migraine, or it could be something with some of the other structures in the neck, like the muscles and joints, or nerves that are being impinged by muscles and spasm up at the back of the head, that again often physical therapy or different kinds of exercises or nerve blocks or those kinds of treatments can often be real helpful for.
Thank you. Our next question comes from Kelly. Are there any foods or food types that are linked to fibromyalgia?
There are a lot of different foods that people have linked with migraine, not so much fibromyalgia. And it's really kind of unclear if there are nutritional treatments for fibromyalgia in the same way that you may follow diets to try to decrease headache activity. With fibromyalgia, probably the most common issues would be digestive problems, either problems with constipation, diarrhea, or irritable bowel syndrome, in which case adjusting your diet may be helpful for that, or using probiotics in addition to a healthy diet may be helpful for that. But really, trying to follow different food regimens or different nutritional therapies for the most part has not been found to be real helpful for fibromyalgia. Now, that being said, eating a healthy diet is always a good thing to do, and probably the most important thing to do diet-wise for fibromyalgia is to keep your weight down. And as you probably know, obesity and being overweight is just really a huge problem, both in the United States and also worldwide. And more of us are overweight and obese than our normal weight, so that obesity has really become a major major health factor for a whole host of conditions. And people have looked at the role of obesity with fibromyalgia, as well as obesity having a role with migraine. And clearly, increased weight does not cause migraine. Increased weight does not cause fibromyalgia. However, if you happen to have migraine or you happen to have fibromyalgia, being overweight tends to make those problems worse. And studies very consistently show that when people are overweight or obese, they become more sensitive to pain in the same way that people with fibromyalgia become more sensitive to pain. So if you're already more sensitive to pain with fibromyalgia, if your weight then goes up, that pain sensitivity will even be more magnified, which is a problem. And the reason for that is probably because as our body develops more fat tissues, that's linked with an increase in inflammatory chemicals in our body as well. And it's those inflammatory chemicals that are probably what's aggravating pain, whether it's migraine pain or fibromyalgia. So one of the most important things one can do nutritionally is to really look at your diet, look at your weight, see, do I need to, drop some pounds, which you may be able to do with, diet and exercise. Unfortunately, you usually need to use diet as the main component for losing weight. It's hard to exercise off all those extra calories that are real easy to eat. But it's important to remember that that extra weight can be a really important factor, not in causing fibromyalgia or causing migraine, but in aggravating the symptoms that you have. So trying to get that weight down is probably the most important thing you can do nutritionally.
Thank you. Our next question is from Anne. I have daily chronic migraine, and a recent MRI showed a TIA. What about developing fibromyalgia after a silent stroke, and what is the neurological cause of it?
Yeah, with migraines, and this may not apply to you, but just for the rest of the group, it's very common when people have migraines, and particularly have had migraines for a while, to have changes on the MRI scan that will be, little white dots that the radiologist will often read as it could be multiple sclerosis, it could be small strokes. Sometimes they may even say it could be cancer. So you can always get these very scary reports, but really probably about a quarter of people who have migraines, if they get an MRI scan of their head, will have, the occasional little white dot, which doctors don't really seem to know what that all means. And that's been that way for decades, and a lot of research has been on looking at what those little white dots mean, and no one's really come up with a good answer. It doesn't seem to be any particular pathology or something to worry about, but as the patient, when you get that report, it can be very scary. Now, that being said, one can also have a TIA when you're a migraine sufferer, and there actually has been a bit of evidence that shows that if you have migraine, particularly migraine with aura, you are at higher risk for developing strokes, you're at higher risk for developing some heart disease, which is all the more reason if you do have migraines to decrease those heart risk factors like being overweight, exercising, keeping your blood pressure down, keeping diabetes under good control, all of those good things, because migraine does increase that stroke risk a bit as well. I would not think that having a TIA would be a likely precipitant for fibromyalgia symptoms. That's not really a very common link that people talk about, or I've ever heard people saying, my fibro started after I had had a stroke. So I think it may very well be that those are two different phenomena. On the other hand, having had that TIA really should be a good warning that this is a really important time to look at what heart disease risk factors you have, or stroke disease risk factors you have, which are all heart disease risk factors as well, and see what can I do to make my risk as low as possible so that I don't have future TIAs or strokes.
Thank you. Our next question comes from Nancy, and she wants to know, with most meds carrying that weight gain issue, what is your suggestion?
Yeah, it's really very frustrating, isn't it, that you're supposed to keep your weight down, and then a lot of medications tend to increase weight, which is always problematic. The thing to remember with most of the medications that increase weight is the medications are not directly increasing weight. Often what the medications are doing is boosting up one's appetite. So it's making you want to eat more, which you then do eat more, and then you gain weight. So, if you're taking a medication that has a risk for weight gain, the one thing is, if weight is an issue for you, is to ask your doctor, are there alternative medications or other options I could take where weight gain is not going to be so much of an issue. And they may tell you yes, they may tell you no. If the answer is no and you do need to take a medication where weight gain is a side effect, is to really, be monitoring your diet, monitoring your weight, and to see, is your weight increasing or not. If that medication is really very helpful for your symptoms and so that you do want to keep taking it, then the thing to do is to just really make sure that you're taking other steps to keep that weight down, cutting back on calories, boosting up your exercise as much as you can, and really monitoring your weight on a regular basis so you're sort of catching, oh, I've gained a couple more pounds, I need to really keep an eye on that. And one of the things that can be really very helpful for keeping weight in check is to actually make sure that you are weighing yourself regularly. And it really sounds very simple, like, you should know if you're gaining weight or not, but it's really easy to not be aware until you've gained, 5, 10, 15 pounds, and then suddenly say, oh my goodness, I've gained, a big chunk of weight I need to get rid of, versus if you said, boy, the last few days I've gained, 2 or 3 pounds, or over the last few weeks I've gained 2 or 3 pounds, so I really need to do something to get that down, and keep myself under check. And if you're taking medications that tend to increase your appetite, that definitely does make that much more difficult and much more challenging. Unfortunately, there are some circumstances where that is a medication that you really need to take for decreasing other symptoms. But again, to just be aware that that may be boosting up your appetite and using other strategies to try to keep your appetite down, exercising a bit more and just monitoring your weight to keep it under check.
I think our next question is from Thomas. Is there a relationship between fibromyalgia and sleep apnea?
Fibromyalgia is really linked with a whole host of sleep disorders. And there was actually a recent research study that linked migraine with some genetic sleep disorders as well. So both migraine and fibromyalgia really seem to have a lot of links with sleep disorders. And sleep apnea, is a very common disorder for people to have. Insomnia is probably the most common sleep disorder people have with both migraine and fibromyalgia. But, if you have sleep apnea, that really can be a very serious health problem and something very important to make sure that that's treated. So that, again, should be treated sort of separate from the fibromyalgia. And not, sort of waiting for the fibromyalgia to get better. Some of the treatments, again, which may be focused more on improved sleep and decreasing weight and those kinds of things may be helpful for both of those conditions. But in many ways, the treatment for fibromyalgia and sleep apnea may also be very different. Well, I think that was our last question. I want to thank everyone for joining me this evening and talking about fibromyalgia and migraine. And again, I think the great news about both fibromyalgia and migraine are these are conditions that doctors are beginning more and more to understand what's going on. It's very clear with both of those conditions that these are very real, physical, biological changes happening in the body. And because we know they're biological changes, that really helps doctors and trying to come up with different therapies that are helpful. If you have fibromyalgia, make sure you're seeing your doctor, seeing what treatments can be done. And again, as your doctor is talking to you about different medications, don't forget the important role that exercise plays.
Thank you, Dr. Marcus. I'd like to thank everyone again for joining us this evening and invite you to become a member of the National Headache Foundation if you're not already. You can join at www.headaches.org. Your membership helps us to continue our mission. And also, if you'd like to join us May 21st with Dr. Wade Cooper, who will be presenting on allergy